Can you tell us a little bit more of the animal that gets selected to treatment with epinomectin?
So the idea of the selective treatment is to aim at the animals that are most susceptible to gastrointestinal nematodes. So it would be, for example, the youngest generation. So in a dairy flock, it'd be the first lactating ewes. And then in the other ewes, then we would choose mainly the animals that are in a bad body condition. What was a bit innovative about our protocol is that we were basing our treatment decision upon what the farmer appreciated from its herd. So it was mainly a bad body condition score, but it could also be weakening, anemia, it could also be signs of diarrhea.
How do you selectively choose the animals you're going to treat?
Well, basically, we sort out the thin ones. And often among the thin ones, there are usually the young ones, the yearlings, like in the coprology we spoke earlier. It's really the young ones who struggle the most with parasitism. So we tend to target the young and the thin ones.
Okay.
So the body condition score. Unless the whole group is really thin and we can't distinguish, and the coprology shows otherwise, then in that case, we don't rule out treating the whole group, or maybe just leaving a minority untreated, 15 to 20%.
We realized that treating systematically all the flock wasn't beneficial. So we implemented targeted treatments. Animals in lactation 1, lactation 2, and the oldest ewes, and the few that are really thin and can't regain body condition. Otherwise, we haven't treated ewes systematically for 3 years, since the project we started with you.
Can you briefly go back over how you choose which animals to treat?
So, when you came at the beginning, you asked, what do we do? And I said, at first, we treated everyone. Then we said we should do targeted treatment. And so we decided on lactation 1 and lactation 2 animals because they're the youngest. Lactation 1 at the end of growth, beginning of lactation. It's the first time they're really eating with the whole group, getting exposed to contamination. So we said, we need to protect them. We systematically treated the lactation 2, and we also treated the last generation, the oldest ewes. There weren't many, but we thought, they're nearing the end of their lives. Maybe we should protect them. So we did that the first year. Now we almost always treat the one from first lactation, the old ones. And then we look at the other generations based on body condition and production loss they're experiencing at that point in the selection process.
Can you tell us how easy the protocol was? Was it accepted easily by farmers, and was it quick to implement in the farm? How easy was it?
It went over pretty well. The protocol was quick to implement. The decision was usually quick and relatively easy for the farmer. So they did not have the impression that it was an extra load of work. And the result was pretty good. They were generally satisfied with the result. They did not see any change, like any visible change compared to prior years where they were treating all the animals. So that was what we were aiming for, and that was globally satisfying.
Were there any impact on production traits?
So what we did is we evaluated the potential impact of treatment or non-treatment upon reproduction. So in the farms where the selective treatment was done about a month before reproduction period, we saw no significant impact upon reproduction, various reproductive criteria. And as we were kind of expecting, there is limited loss in production in the multiparous ewes, so the ewes that have more than one lactation. And there is, so the animals or the ewes that are treated produce up to 8 to 9% more than the ewes that were left non-treated for a limited amount of time. We're not quite sure how much time, but it could be somewhere between 2 weeks and a month. So there is an expected drawback, but again, the farmers were overall satisfied, and it's not something, they did not see a dramatic decrease in milk production as they were milking the ewes.
What did you learn out of this protocol?
The balance with the main objective of selective treatment, which is to maintain ivermectin efficacy for as long as we can. And that is also something we evaluated in our protocol. So at the beginning, and what we saw is that farms where at the beginning of the protocol, ivermectin was very efficient, so above 95% fecal egg count reduction. Then ivermectin was still efficient at the end of the protocol. So that's encouraging. It's encouraging to use selective treatment as much as possible to try and postpone as much as we can the appearance of resistance of ivermectin because that has quite dramatic effects in the dairy flock.